Welcome to a new episode of our weekly series on COVID-19, Science in Context. The UK has now reached more than 4.3 million confirmed cases, and more than 33 million adults have received the first dose of a vaccine. This week, there have been concerns about a new variant first detected in India. I'm Stephen, and joining me today is Professor Neil Ferguson. Neil, how concerned should we be about the emergence of variants such as the one first detected in India?
As we saw late last year in the UK, variants can change the epidemiology of this epidemic quite dramatically, and that's what led to the third lockdown in the UK. So we're in a good position right now, but we need to keep an eye on it, and things can change, and we can't keep variants out forever, and so we need to be thinking about updating vaccines.
Have you seen anything to indicate whether the UK is still on track to continue easing restrictions?
Well, trends in case numbers and hospitalisations and deaths in the UK are very positive right now. But the whole point of the government's roadmap is to leave a significant gap between each stage of relaxation to monitor what's happened in the previous one. We haven't really seen the effect of what happened back in April. Children only back in school now. So the team here at Imperial is spending a lot of time in the next few weeks studying the data and modelling. I have no reason to believe we're not on track at the moment, but it's too early to be definitive about that answer.
India is seeing cases surge to record levels. What are your thoughts on the situation there?
It's a tragic situation, and you'll be aware a new variant has been discovered there. We don't know at the moment very much about it, but it may well be it's behaving a bit like the Kent variant here and making control much more difficult. We've seen this before, so in Brazil, which had its health system overwhelmed in recent months by COVID. It's tragic when people are unable to get healthcare, and that drives up mortality rates. I realise hospitals are running out of oxygen now. It's, in some sense, unfortunately not unexpected, but tragic nonetheless, and my thoughts are with people of that country right now.
Neil, thanks for your time.
Thank you.